new figures show around 1 in 10 full-time jobs in the NHS in England were vacant at the end of June. That's the highest proportion since current records began in 2018. NHS digital data shows that in London the figure is 1 in 8, with 30,500 jobs unfilled across mental health, ambulance and specialist services. Well, Krupesh Hirani is Labour's London Assembly health spokesperson, and I asked him earlier what concerns him most in these figures.
This has a real impact on services being able to be delivered safely, quite frankly. If we look at the burnout of staff that are in the system, so there's a lot of attention, I think, on the numbers and the shortages, but for those who are working in the system at the moment, they are tirelessly going beyond the call of duty, working extra hours, and that will have a long-term impact on them as well.
OK, so, I mean, we've seen the data, so where's the solution?
So, I mean, if we look at the reasons why this is happening, there are multiple reasons. One is burnout, which I've already mentioned, where staff are going above and beyond what is their prescribed role. But actually, if you look at what's happened over the last 12 years, looking at austerity, looking at pay freezes, which people have had to endure, look at pay, look at some of the buildings that people are working from. We had a promise from the government for 40 new hospitals across the country. 6 of those were supposed to be in London. And if you think about the conditions that the buildings that people are working in, that is having a great impact. So we need to see some of those promises delivered. Also, if you look at one of the other key landmark pledges from government around having 50,000 nurses coming into the system as well, if you look at the figures today, what we're seeing is a massive shortfall. It's beggars belief that the government still feels that they are on track to deliver their pledge on nursing numbers when we're looking at the figures that we are looking at today. So we need more support in terms of terms and conditions for nurses and workers in the NHS as well, but training incentives for those going into the profession as well.